Hi, on this episode we'll talk about raw veggies and your sleeve. What fits better in your sleeve? What type of food and why? We'll talk about decaf coffee, regular coffee, and alcohol consumption.
Jump.
Amy asks, it is true that you should not consume raw fruits or vegetables with the sleeve.
Is it true that you should not consume raw vegetables, raw fruits? Well, that actually is not true. It's actually really good for you. Raw vegetables and fruits are really good because they don't lose certain nutrients that may get lost if you actually cook them. Certain nutrients, certain vitamins, certain food actually lose these nutrition complements that actually are really good for you, that you could benefit most out of them rather than if you cook them. So it's not true that you should stay away from them with your sleeve. It's actually really good for you to consume them. So don't stay away from them.
Why can I consume a large amount of vegetables and fruits with the sleeve compared to protein?
So it all has to do with the amount of liquid or fluid the meal or the food has. So fruits and vegetables, you will be able to consume a little bit more. They go better down the sleeve because they're more hydrated. They got more water in their content that actually helps to lubricate and go down the sleeve easier versus protein, where you're talking about protein. I'm guessing you're talking more about red meat or chicken or maybe some salmon. That is more dry. I mean, you think about a chicken breast, which is really dry. It'll fill you up really quick because it doesn't have moisture in it. All right, versus some fruits or vegetables that are more have more fluid, and of course they'll go down easier. So that is a reason why you can consume certain amounts of fruits and vegetables, much more than with protein if you're talking about red meat or chicken.
How long do we have to wait before drinking alcohol?
Talking about alcohol, it is very important that you understand that while you're losing weight, your metabolism to alcohol is different. Why is this? Because you're going through a lot of changes. Your liver is going through a lot of, your liver is very busy going through a lot of metabolism, metabolizing all this fatty acids that are being burnt in your body and getting rid of. So your body is going under a lot of stress while you're losing weight, which is good and expected. But when you intake alcohol, what happens is your liver puts a hold on the alcohol because it's so busy with all your things in your body while you're losing weight. And since it puts a hold on that alcohol, your alcohol levels in blood, because they're on hold, will start to rise in your blood. That way, you get drunk quicker and it'll last you longer because the liver only grabs a bit, metabolizes it, grabs a bit, metabolizes it because it's busy, right? So it's a simple way of putting it, but just think about this example. While you're losing weight, your liver will metabolize alcohol slower, your alcohol levels will rise higher, and it will last you longer. So yes, you become a very cheap date. But remember, it's just temporary. Once you hit goal, you stabilize at a certain weight, everything returns back to normal.
Loretta Matthews asks, when can we have decaf coffee?
Decaf coffee, well, I can let you know that you can start drinking it right away after surgery. Once your surgeon gives you good to go with clear liquids, you can start doing decaf. Maybe you can start, depending on your surgeon's preference, you can start doing regular coffee once you hit week 2 or week 3, and take off after that. But decaf, since it doesn't have any caffeine, there is no content that irritates the sleeve. Be sure it's not too hot. I mean, it's just warm coffee is good. Don't push the sleeve. Remember, the first few weeks after surgery, there's fire going in. You want to put out that fire. You don't want to put more fire in there, so you want to ease it up. So not too hot. It's just warm coffee. Decaf you can do right away, along with decaffeinated teas, which are also allowed. But check with your doctor. Regarding our practice, you can try it right away. So don't forget to subscribe. We'll place the button right here on the screen. Remember, if you want to ask me a question, use the hashtag AskDrA. If you don't use the hashtag, there's no way for us to pick it up, all right? So AskDrA, we'll pick it up on Twitter, Instagram, YouTube, and Facebook, and we'll see you next time.